This is the weekly Wednesday review of COVID and all things COVID that are going on in Davis County. As you notice, I have my mask on. I'm sitting here in my office by myself, but I put the mask on just to show you the proper way to wear the mask. You'll notice it's over my chin and over my nose. There's a little piece there that you kind of press on, makes it fit a little bit tighter. This is not the way to wear your mask. It doesn't do any good when you've got it like this. Certainly, this is not the way to wear your mask. This is not the way, nor is this the proper way. When you're wearing that mask, you are helping protect your neighbor. You're helping protect your loved ones. It also gives you some protection, but your protection comes from your neighbor and your loved ones wearing their mask when they are around you. So today, it's my pleasure to introduce Clay Horton. He is the head of the Green River District Health Department, and specifically our Davis County Health Department, I guess, Clay. Clay and I serve on the Health Department board together. And before we go, Clay, Jordan, I know you're on there listening. We are on a live Zoom meeting. This is going out on our Facebook page, and I think, folks, that you can or have the ability to send us your questions. Type them in. Either they'll come directly to me, or Jordan Rowe, who is monitoring this, will get them to us. So first of all, Clay, what I want to do is review a couple of things with the folks. The latest statistics, if they haven't seen it as of today, the report that we get from the health department every day, we have a total of 2,147 confirmed cases of COVID-19 in Davis County. Currently, there are 10 folks who are in the hospital. Remember, I've talked to you in the past about how that number often is a predictor of COVID deaths in the future. We have 146 folks who were ever in the hospital. And unfortunately, we have had 32 folks who have had a COVID or died because of a COVID infection. So Clay, if you don't mind, let's just take a second of silence and remember those folks and those families who are no longer here with us. Okay, Clay, I've set it up. I'm going to let you say a few things to start with, and then I'm going to flood you with questions, and hopefully the folks who are viewing this will ask questions as well.
Thank you, Judge. I appreciate the opportunity to talk with you and to kind of get the word out through your Facebook page. We're well past 7 months into this now, and I think a lot of times I feel like I'm a broken record. But at least we are saying some, we're trying to be consistent. We're trying to remind folks. And I think a lot of times, even though this information's all over the place and it's out there everywhere, sometimes it doesn't strike home with you until you've had a personal encounter or it's relevant to your own life. And so although, with so many disruptions that we've had, it's hard to imagine it's not been relevant to everyone's life, but we meet people every day that are needing help and needing information. So I'm always grateful to be able to continue to get this out. So our cases here locally, both Davis County regionally and as a state, are dramatically increasing. It's a very concerning time for us. Last night, Davis County crossed back into that area that they're calling the red zone counties. And what that means is where we have a current incident rate of 25 cases per 100,000 per day. And that's labeled as a critical point or a tipping point. And what we've seen consistently in Green River District is when we have communities get close to that threshold of, somewhere between 20 and 25 cases per 100,000, we see outbreaks in nursing homes. We see the management of COVID and other institutions become very difficult. And that's where Davis County is right now. So it's an opportunity for all of us to take notice of that, to think about how we can apply all the guidelines that we've been talking about over the last several months to our own lives, and how we can be careful for the next week moving forward. So the state has actually suggested a number of things that you do when you get into these red zone counties. They have designated Thursday as being that decision point, and then asking people to commit to these additional recommendations and these additional safety precautions for the following week. So I know that we are at Wednesday, but we will be in the red zone Thursday of this week too, just based on the numbers that we've already seen and know where those averages are. So, things that we're asking people to do is employers, if you're able to allow people to telecommute or work from home or have fewer people in the office, you should be making plans to do that. We're asking, people to consider getting takeout or doing curbside pickup of your groceries rather than making multiple shopping trips. You really want to think about how you can limit your interactions with people outside of your household. And we're asking, like, if you're having gatherings planned, whether those be public or private, that you postpone those or you reschedule those in light of the spread that we're seeing in the community. So these are all sacrifices. They're all inconvenience. They're things that none of us want to do, but it's really important now. And if we all do this collectively, we'll see these rates come down.
Okay. Clay, the one thing, and let's go back to the red zone rate. My understanding is you have to have a 7-day average. So what you're doing is, it's a 7-day rolling average where you kick off the last day and add the current day, divide it by 7, and that's the number. In our case, we've got roughly 100,000, so it's a pretty easy estimate. Today, as an example, and I've just used this as an example, I think Henderson had 25 cases. And Henderson's population, and they may have had a few more, a few less, but just as an example, Henderson's population is about 40,000, I think. So if we've got 100, we've got about 2.5 times their population. So you take 2.5 times that 25. So that's about 62, 63 cases compared to our 29. It kind of gets confusing. The math gets confusing, and particularly when you're converting it for smaller counties or larger counties. But in general, I think what that average does, it's really a predictor of the spread of COVID within the community. And when you hit that 25, I think what the state, the CDC, and everybody else is saying is that it's widespread in the community.
Yeah, that's exactly right. And we also just know that from our experience that when you're at that level, that's when we see it become very problematic. And the other thing that's important to keep in mind, a lot of people will say, well, 25 people per 100,000, that's not very many. Those are just the ones that we have laboratory confirmation on and been reported. We know from several other studies that the actual incident in the community is much greater than that. You'll see anywhere from 10 to 30 times is what they estimate in terms of the actual infection rates. And I've even seen some studies that suggest up to 50. So, it all varies, but it's a measurement. It's a way to kind of keep your finger on the pulse of what's happening. And we know that, what's happening right now, we want to shift that direction and go a different way.
Well, and I like what you said. We know if it's at 25 that it's 10 times, 20 times more prevalent, because during regular flu season, not everybody goes to get tested. Not everybody goes to the doctor. Lots of folks stay home. They have a mild case. They stay home a day or two, take some aspirin. They've had the flu, and those statistics don't go into the number of flu cases that we had. So really, we've got some, and I've heard, as you, the only issue that some folks have had is they lose their sense of taste and smell. I've had a headache yesterday. I'm over it, and pop. They get tested and they're positive for COVID. So Dr. Dufresne and I talked about a lot of the symptoms that you have with COVID are also mimicked by common cold, allergies, flu, and other things. So it doesn't necessarily mean if you have those symptoms that you're infected with COVID, but what it may mean is you need to stay away from other folks the best you can and then go get tested. So we're talking a lot about testing. Tell me the testing schedule that the health department has.
So we've been doing kind of just general community testing on Wednesdays every week. There are lots of other places in the community to get tested for COVID-19 other than the health department. We have offered this out as kind of a low barrier, easy to get test for anyone who thinks that they've been exposed, thinks that they may be sick, or is just wants to check their status. So the easiest way to sign up for that is to go to our website, which is healthdepartment.org. Follow the links for COVID testing, select Davis County, and you'll see a list of all of the available time slots. You pick that, you fill out a very short web-based form, and you'll get an email confirming your appointment. We do this as a drive-through. People are in and out in under a minute generally. You drive over here to the health department, follow the signs through to where we're set up in tents in the parking lot, and it's a quick process. Typically, we're getting the results back within about 48 hours. Anyone that's positive, we call immediately. And then everyone else with their negative results, we usually notify by email. So it's a good process. If you're sick, having symptoms, concerned about whether you've been exposed to COVID or not, and it's Thursday, I'd encourage you to contact one of our other providers in the county to seek that testing. There's lots of urgent cares that are offering this. Private physician offices offering it. Audubon Community Clinic is offering COVID testing, and of course the hospital offers testing through a number of avenues.
Clay, I think I'm correct. You're using the PCR test, the more accurate test, as opposed to the rapid test, which I think tests for antigens, a larger false positive or false negative in that test as opposed to the PCR test. Now, am I right? The PCR test is the one that uses a swab that is this long?
It's pretty long. It's pretty small and skinny too. So, it's. I'm not going to say it's comfortable getting swabbed with that phalangoneal swab. It's a little uncomfortable. Makes your eyes water a bit, but it only lasts a second. It's certainly worth it. And you are correct. All the testing that we're doing at the health department now is the PCR. It's the most accurate. It's kind of considered the gold standard. We are looking. We've ordered some equipment. We're expecting some supplies being shipped to us directly from the federal government to utilize some of the antigen testing. While it's not as accurate, there's some advantages to it. You get a result in 15 minutes, and so there's some settings where that is beneficial. So we're going to try to utilize that the best we can. Sometimes that may mean that we get a probable result with that quick test, and we might want to follow up with a PCR test to confirm. But yes, right now the testing you get on Wednesdays is the best available.
Okay, and I'm not sure if you mentioned it, but if I'm not mistaken, if you can make the health department testing, that is free of charge. Is that correct?
Free of charge. We don't bill insurance. We don't charge anyone. You just
Right.
sign up on the internet and show up for your test.
Now, how do you determine where you're going to have this drive-through testing? Is it always in one spot? I know when early on we did some mobile testing in various areas or neighborhoods.
So right now we've been primarily doing here at our health center on Breckenridge Street, but we have had organizations reach out to us. We've had areas that at certain points during the pandemic that we identified where we weren't getting enough testing, so we didn't do mobile sites. We did one at the sports center. We've done some with some of the different community centers. We've done them in other counties other than Davis County. So right now we can get the most bang for the buck. We can test the most people with the resources we have by centralizing it. But I mentioned some of these antigen testing supplies that we're in the process of trying to acquire. One of our intentions with those is to resume doing the mobile testing again. I'm sure we'll adjust as we get into winter based on weather and just the need of the community. But one thing that I've noticed is just there have been other partners within the community that have been able to offer testing in other locations and really help assist and fill that gap. So we still have the ability to do mobile testing sites, just haven't had the demand or need to here recently.
I think, and again, you can say, Al, you're wrong, but if someone had a population they were concerned with and wanted to perhaps talk to you, they're welcome to give you a call, tell you what's going on, and either you could set something up or suggest another alternative.
Yeah, I think every situation is a little different.
Sure.
And what we're trying to do here is offer general community testing. If it's an employer or something like that, we can probably have some different options and alternatives that we can suggest and can talk with anyone.
And folks, I'm kidding. It's not that long. And I did have, my wife and I were tested back early summer. It was not something I'd want to do every day, but Clay, about the only thing that I noticed was a little burn and it wasn't a burn. It was just a little tingle from maybe the alcohol or whatever. It was not necessarily uncomfortable. It caused me to cough, sneeze, or I don't think they pulled any of my brain out because I don't think they went up that far. But
No, not quite.
if it had been Halloween, they may have done that. One of the things that I want to ask, and I've had this on a couple of occasions for people I've known. As a matter of fact, I've had some good friends, husband and wife, who tested positive. But I've also had some folks where one of the spouses would test positive, the other is negative. How in the world do you live in the same house with one person who is positive and the other negative so that you don't transmit that disease?
Well, everybody's house is a little different. Everybody has their own unique circumstances, but what we try to coach people to do and encourage folks to do is to isolate as much as possible from each other, especially if one of them is not infected. And that might mean, staying in a separate room, eating your meals apart. Obviously, you want to check on each other. You want to make sure that the one that's infected is doing okay. But we have some guidance that we give out. I mean, it's not rocket science. But if to the greatest extent possible, if you can isolate from each other, then you're improving your chances of others in the household not becoming infected. Now, sometimes we have situations where you have young children, and that becomes very difficult. And so we ask people just to work through that the best they can. But when you do have to be in the same room with each other, you can wear a mask, especially the infected person being able to wear a mask. That goes a long way in terms of protecting other people in the household. Again, eat separately. Try to use separate restrooms or bathrooms if you can. But we can talk through that. Every time we have a positive case, we have a disease investigator that reaches out and talks to that individual, and giving instructions like that and figuring out everyone's specific situation and giving good guidance is one of the things that those investigators are doing on those calls.
Okay, that segues into our first question from the public. Why are people not being notified quickly if they've been around someone who is tested positive for COVID? In some cases, it's been up to 4 or 5 days past the person testing positive. And one of the reasons I think I can say is we just don't have enough contact tracers, probably. As the number of folks who are positive go up, their number of contacts go up, it takes a while to do the investigating that's necessary. And also, you've got to look at the data and see, is there really a need to contact some of the folks that they've been in contact with? So, Clay?
Yeah, there's delays. Sometimes there's delays in reporting from the provider. Sometimes there are delays in being able to reach the person that tested positive. And you're correct. When we have the number of cases that we're having now, it slows the process down, and sometimes it does create delays. Now, our goal is to do this as quickly as possible. We typically try to get them all contacted the same day that we get the report. Now sometimes it's 2 or 3 days before we're notified from the provider, even though we ask that they notify us immediately and no longer than 24 hours. The other thing that creates some confusion sometimes is, we're looking at a very specific period of time where we think the person is infectious, and we're looking for people that we think are at the highest risk of being infected, and those are those close and prolonged contacts. So there's a process where we interview the case about who those folks might be, and then get names and numbers to contact them. If we are given that information, we get onto it very quickly. We also do some additional follow-up if there was a school setting, or if it's a setting in a workplace. We'll talk to those facilities as well, and sometimes we learn of additional contacts that way. And so all of those steps sometimes prolong the process. We have started with more talking to cases now, people that have tested positive, trying to let them know what type of things that we're going to be telling people that they come into contact. Sometimes they forget to mention someone. Right. So we're trying to prepare them with, if you think of someone else, here's the things that they need to know. And if there's any questions at all, they can always reach out to their case manager. They can call us here at the health department. But I will assure you that we're trying to get a hold of everyone as quickly as we can. There's There's just more than we can keep up with at the present time. And that's not unique to the Green River District Health Department. Just when you see this level of cases, contact tracing is less effective, just because there's more to do. There's more cracks to slip through, and there are people being exposed in multiple ways within the community, and that makes it difficult to figure out what's happening.
Clay, this is just while I've got you, and this popped into my mind. A friend after last week's meeting with Dr. Dufresne had texted me and said, Al, what in the world is going on at the health department? There are people in the health department who are not wearing their mask. And you know, my answer was, my understanding is they wear their mask in those common areas, go in, then they might go to a treadmill, or they social distance walking around the track. Certainly it would be hard to exercise for me. It's hard for me to walk up the steps here at the courthouse with a mask on. But I'm thinking that that's just part of that protocol set up for the health park, where they understand people can't be wearing a mask when they're exercising, but in the common areas they should. And then they sanitize the machines and do all that. So I'll let you, if I answered, I'm sorry, but you add your expertise.
Yeah, so I think that's right. And if people have questions about what those guidance, what we suggest and what those guidance are, if you go to the Kentucky Healthy at Work website, there are sector-specific guidance on what they expect in terms of minimum safety standards and best practices, and fitness clubs are included in that. So you are correct. If you're in areas, if you're close to other people, you certainly need to have your mask on. I would encourage you to wear your mask as much as you can in that facility, but there may be circumstances where that's not as practical. But as long as you're following those guidelines, then you are reducing the risk. And at the health park, I'm sure you can't wear your mask in the swimming pool, but we know that that's relatively low risk if you're swimming by yourself or in your own lane. So it's all specific to the circumstances and where you are, and it's infection control. We just have to adapt for what we're working on.
I like what you said, reduce risk. A lot of people think that they can completely eliminate the risk of infection. And I'm going to tell you, folks, unless you live in the woods and are never visited by anyone or brought anything handled by anyone, I don't think you can 100% eliminate the risk. But it's all about eliminating as much as possible those risks. That's why, a lot of folks will talk to me about, why in the world do I have, if I wear a mask, we shouldn't have any regular flu, right? Because I'm preventing it. Well, yes or no, that reduces your chance, but I'm also going to get a flu shot because that's going to be my second line of defense. If it gets by the mask, I want to have those antibodies created by that flu shot. So you can't eliminate 100% of the risk. That's why, you can be as careful as you want, go out, get in your car, back out of the driveway, and somebody whack you. You're careful. You're a careful driver, but it's the other people that you really have to be watching out for. Second question that came up, should everyone in a household quarantine if someone in the house tests positive?
More than likely, yes. So, again, that's part of the investigation procedure, is to find out what the nature of those contacts. So, we've had a few where, the person who tested positive was a healthcare worker. They were concerned that they had been exposed, and they had already self-isolated in their basement. And so we have found some that where we thought those were pretty low risk. But I think as a general rule, your household contacts are among your highest risk contacts. And I think in the normal situation, everyone in the home should quarantine.
Let's talk about statistics real quick. Where's the best place for people to go? I know you guys have them on your webpage. We have them on our Facebook page. Kentucky COVID-19.kentucky.gov, I guess. The CDC has it all. I mean, you can go anywhere and everywhere and find all those. Where's the best place to look for our community?
So we do. If you're wanting a daily update to see what's going on, I think our webpage, healthdepartment.org, or our Facebook page for the Green River District Health Department. But most people, when I'm asked that question, I refer them to kycovid19.ky.gov. They are publishing every day the current incident rate. And that's what we were talking about, these color codings. You have a green, yellow, orange, red. And we've worked very hard on our process here at Green River District about when we investigate cases to streamline and to get those cases in the state data set as quickly as possible. The lag that we had early on was several days. We're not seeing that now. We've changed our process completely so that it's in the state data set immediately as soon as we get the documentation and confirm that it should be a case. And so our numbers that we keep internally and the numbers that you see on that website are not materially different at all. And I think it's a good centralized uniform reference for everyone in the region, everyone in the state, to see what the status of your community is. And then also on that webpage, they have good practical recommendations based on what those risk levels are. So if there's any questions about that, you can certainly reach out to us here at the health department. We watch it closely to make sure there's not errors. So, we do have to calculate our own rates and kind of watch that. But so far, we've been tracking that since late July, and we have never found a material difference in any of our counties.
There is some delay sometimes. You might get some that we would report today, the state reports tomorrow, but in the end, if you look at a segment, it all catches up.
It all catches up. Yeah. I mean, we all have our cutoff dates when we're making our calculations, right. and that's going to play into it. The thing that will lag a little bit are our death reports. Okay. So, we try to be as comprehensive as we can here locally before we report a death to make sure that it truly is something that's related to COVID-19.
That's what I wanted you to explain, why the lag is there. And it's actually the investigation as to, is this, certainly if somebody has COVID but is killed in a car accident, that's not reported as a COVID-19 death. No. But certainly if someone has COVID and should die of pneumonia as related to COVID, that's a COVID related death, COVID caused death. So a lot of people get those things confused. And I noticed on my email yesterday, somebody sent out that old urban legend that's been circulating around where they go in and the CDC, by their own admission, and the 225,000 deaths nationwide is reduced down to about 13,000 COVID-related deaths. Folks, I'm here to tell you that's a bunch of bunk. Do not believe those kinds of things. Why in the world would you believe someone on Facebook over the actual statistics and the health experts?
Yeah, that's all correct. And, we do that review here locally before we report those out. Then when it gets to the state level, there's a committee up there that independently reviews those. So that creates a couple of days delay between our numbers and the state's numbers, but it's for a good reason. And it's to make sure that we're not attributing deaths that should be attributed to something else, to COVID-19, because there's a lot of scrutiny over it and we want it to be accurate.
Okay. Just one more time, tell me, why in the world should I wear a mask? Why in the world should I socially distance? Why in the world do I wash my hands? Why in the world do I have to avoid crowds? I've got friends everywhere. One friend never wears a mask and hasn't had a case. I've got another. I went to a party the other day, a Halloween party that had 50 or 60 or 100 people there, and I'm just fine. Tell me.
Well, it all goes back to the risk factor, right? And the more that we can do to prevent this, it's going to reduce our own personal risk. It's going to reduce our risk in our families. And then ultimately, it's going to reduce the risk for our community. I hear the same objection a lot, and I think that it's a lot like, and this may be a clumsy metaphor, but I think it's a lot like what we've heard in public health for years. That my great aunt lived to be 109, and she smoked every day of her life. That doesn't mean that smoking doesn't cause lung cancer. It just, it all based on your risk. But wearing these masks, it's very simple. This virus is invisible. It's spread by our respiratory droplets, and this catches our spit and keeps it from hanging in the air, in fact, infecting other people. And we believe that wearing the mask, it makes you less likely to inhale someone else's spit. So that's it. Simply is that if we do these things and we do them collectively, we will not have as much spread in our community, which means there's less risk in our community, which means that we don't have to be as vigilant about all of these measures that we're asking everyone to do. So if we can get on the same page and we can cooperate for a period of time, all of these things will get easier. And then, that's when we can be more effective in our contact tracing and trying to contain. We've got a level of spread in the community now that our contact tracing is trying to slow it down. But when we get to a low level in the community, it really has a significant impact in terms of stopping the spread. And that's the position that we want to be in.
A personal touch, the 1918 influenza pandemic. I mean, not the last, but it was the large global pandemic that we saw, killed lots of people, millions of people around the world. In 1918, my dad, who was not born, he was born in 1919, had a sister born in 1918. She died. She died from the Spanish influenza. And it wasn't just during 1918. There were many plateaus hit and resurgent. And in 1922, my dad's mom died from the Spanish influenza. So it's real. And, again, so far, I know some people who have passed away. Most of the folks that passed away have been older folks. But that doesn't mean that younger folks haven't passed away, and people in their teens and in their 20s and 30s and 40s and 50s. And I always hear the statistic, well, 1% of those infected die. And I think it's a little more than that. At first, it was pretty large, upwards to 8 or 9%. But it's a whole lot like this. Do you really want to take a chance?
No, you don't.
Really want to take a chance?
No, and I don't think we do. And the other thing is that this gets multiplied within our community. And when we talk about people that are less vulnerable, that they're younger, they're healthier, they're probably less likely to have a severe outcome. Not that they're unheard of, but if you're spreading it in your community, you're increasing the chances for those that are more vulnerable to die or have a severe outcome. And so I think it's something that we just have to think about, that we're all doing our part to protect those around us and those that we care about.
Those young folks who don't seem to have any symptoms or many symptoms are taking it home to mom and dad, who then take it to grandma and grandpa. And all of a sudden, grandma and grandpa aren't around for Christmas or Easter or graduation. Tell me, I hear some people being frustrated sometimes, Clay. They've gone to a store, gone to a restaurant, seen lots of people without masks, reported this violation, and it seems like they go back to that store again and the same thing's happening over. Tell me a little bit about how those violations are investigated and what happens.
So we work a lot of mask complaints or non-compliance complaints in general. We have a team of health environmentalists. They're the same folks that inspect restaurants for food safety, right, and look at other complaints in the community. So those complaints come into us. We try to evaluate how's the best way to approach them. So if it's a public facing business like a store, if it's the first time we've had a complaint on that establishment, we might give them a phone call, make them aware, provide a little education. We get a couple more complaints, and then we're going to do an in-person visit. Same thing. We'll try to provide education, provide maybe some tactics and some strategies to get people to comply. We can sometimes talk through that and work out issues. But then if we continue to have issues, then we do cite these businesses. First citation, the first official citation that we've talked to you several times before we get there is a warning. And then subsequent citations can result in fines. We take that responsibility seriously. But I think it's important for everybody to understand that, those fines alone are not going to get us to a place where people are complying. We all have to collectively as a community demand that of each other. And when I say demand that, I don't mean go and have a confrontation with someone, but vote with your dollars or enforce with your dollars. Let the business owner know that you don't feel safe shopping there in this environment. Ask them to enforce this within their establishment. And if they don't, then patronize somewhere else. And I think the same thing, we all have to, in our workplaces, if we see someone that forgets to wear their mask or not wearing their mask appropriately, we have to politely remind them. We have to speak up. And that makes everyone else around us them feel more comfortable as well. So it's not a perfect solution, but we'll do our part here at the health department in terms of enforcement. But I think we all have to kind of strive for that societal norm or that community norm, where when we're around other people, if we're considerate, we're going to be wearing our mask.
You know, it's funny. You were on the air prior to us going live, and the county attorney walked in my office. Now, I'm in my office, big open room. I don't wear my mask in my office, but the minute he walked in, I picked my mask up and put it on. The funny thing was, he reached in his pocket and put his mask on. So it's just that it's nothing. I'm going to violate the man. It's just you forget a lot of times, and it's almost become second nature now for me here at the courthouse. When I go out of my office into the common hallway, I put the mask on. If I go to the break room or the bathroom, I put the mask on. When I go out into the common hallway of fiscal court building, I'm wearing my mask till I get outside and in my vehicle. So it's one of those things. A little thought at the beginning, but it becomes second nature. I hate it that we've got to do that. I hate it here. You know, I don't have that many years left of my life to enjoy the freedom of not having to wear a mask. But because I'm concerned about the folks that work here, I'm concerned about my family. I'm concerned about those around me, that I'm gonna do everything I can do to protect them, and I hope they have that same consideration. Clay, we've been at it for quite a while. I want to be respectful of your time. Can you tell me anything about schools? You know, when the governor had talked about schools and folks going into the red zone, that they should start having virtual school. I know that we were in the red zone for just a very short time, and the Davis County Public Schools and Owensboro Public Schools have decided to continue their in-person classes on a modified schedule. Have you heard anything regarding schools here?
Well, in terms of the red zone recommendations, I haven't talked to them this week. The schools were closed yesterday for election day, but I'm sure we'll be talking. Those are complicated decisions, and I fully stand behind our recommendation to go to non-in-person classes when we have a high level of community spread. One thing that we're learning from our experience, and we're seeing this in all of our counties, is the schools are doing an excellent job in terms of the practices within their buildings. There's no denying that. And I know for a fact in Davis County, we don't have any secondary cases that are related to school in-person classes. Even in some of our other counties where we think possibly there is, it's really difficult to tell because there's multiple exposures. But one thing that we have noticed is when school's in session, we act differently as a society. We act differently as a community. Parents are interacting with each other, and maybe it's daily pattern shift. You're at work more in person. So we think that what schools do has an impact on the broader community, but those are difficult decisions. There are drawbacks and negatives from kids not being in the building for not only their learning, but other safety and social impacts. So I don't envy our superintendents and our school boards at all for making that decision. I do think that they all listen to our health recommendations. They do give it the right consideration. Nobody's being dismissive of the risk and what's going on in the community. But I am not going to second guess their decisions. We'll make the best recommendation that we can. And then we're going to try to support them here at the health department the best we can. And we hope that the rest of the community does the same.
Okay. Clay, thank you very much for being here. Our next week's guest, a friend of mine, some special guests, former Judge Executive Kelly Thurman from McLean County, and his wife will be here. And I don't think I'm violating HIPAA or anything by telling you that Kelly and his wife went through COVID-19 infection. And they're going to be here to tell you what it's really like to have the infection, what it's like to go to the hospital, what it's like to recover or try to recover. I think it would be interesting. So I look forward to seeing all you folks here. Clay, stay safe, and thank you and your staff for all the hard work they're doing for the citizens of Davis County and the Green River District.
Thank you, Judge. Appreciate the opportunity.